in, everybody. Welcome to the very first episode of Paging Dr. Jones, Transforming Wellness Together. Today I'm here with Dr. David Jones, Chief Medical Officer for Anthem Blue Cross Blue Shield in Georgia, of course. How are you doing today?
I'm doing great. Thanks for asking. How are you?
I'm well, thank you.
Good. Well, thanks for having me. I really appreciate it. Excited to be here. So, as you said, I'm David Jones, Chief Medical Officer for Anthem Blue Cross and Blue Shield of Georgia, and I'm board certified in pediatrics, and I've been in healthcare for 25 years. Most of that here in Georgia, right here in Georgia, well over 20 years. So really experienced the growth and changes in healthcare firsthand, and really excited to talk a little bit about more how Anthem is working to lead some of that change in healthcare. Much as you all know, we all know that healthcare is transforming every day before our eyes, right? And so we want to lead some of that transformation. And also it's important that we partner with business leaders and individuals all across Georgia to lead those transformations as well. We want to make sure those changes in healthcare are meeting individuals' needs to improve everyone's lives. So really excited about talking through that more today with you all.
Me too. I'm ready.
Yeah, and then part of why we're here is also, this is the first in a series of podcast episodes that we're excited to bring to everyone. So we really want to touch on healthcare topics that really matter to everybody, healthcare topics that are both pressing and challenging, and also bring solutions and collaborations and what's happening to really address those challenges holistically. And again, it's really important about touching people's lives and making lives better for everyone. So again, excited to be here. Thanks.
I'm excited. I'm ready to get into it and learn something. Okay, so we're going to jump right into it. So what is the central focus of the whole health strategy for Anthem?
Got it. So at Anthem, when we think about whole health, we really are thinking and approaching it through the lens of looking at a person's holistic overall health, their physical health, their behavioral health needs, their social needs, their access to care, just every aspect of healthcare, not just treating one condition or one issue, their overall health. A lot of that's focusing on preventive care. That's such a cornerstone of healthcare in general, and something that we emphasize and support, all around. I think it's also important to note that we are not just looking at healthcare from just the status quo. We are really looking to make meaningful changes in large scale, meaningful changes around addressing health disparities, meaningful changes around improving costs of care, meaningful changes on improving outcomes and quality of care for individuals. And this matters to all of us. If you're a business leader, if you're an individual, if you are starting out in your career new, if you are almost a retiree or retired, if you are, you have all those things matter to everyone, and they impact us directly, and they impact everybody either directly or indirectly. So we believe that really matters, and that's what really we're focusing on with our whole health strategy. Now, the way that we achieve whole health is kind of three cornerstones to it. The first cornerstone really is around personalized care, person-centered care. That's really critical. We use some analytics and ways to really identify what individuals need that's going to meet their needs specifically. The second pillar around whole health strategy is around integration of services, meaning touching with our healthcare providers across Georgia that care for our members, with the health systems, with community organizations, all of those things. And the third area really is around equitable care, ensuring people have access to care equitably, access to treatments that are going to have equitable outcomes. So those are really kind of the cornerstones of our whole health focus.
So you kind of hit on it already, the components of your whole health strategy, but if you can just explain just a little bit deeper all of the components.
Absolutely, happy to. So it's important to start off by understanding or appreciating that 80% of our health is impacted by things outside of the doctor's office or the healthcare facility or health systems that we access. So 80% is outside of that.
Big number.
It is. It's a big number, right? Every time you hear that or repeat that, it's really kind of eyebrow raising. And so what does that mean? So one of the components that really affect our health is the physical health, which everybody fortunately does address and focus on. And there's also behavioral health, which is increasingly important in appreciating healthcare in society, which is great to hear. And then the third area is around social needs. So now going down into a little bit more detail in these areas, when we think about physical health, that means improving and addressing access to care or barriers to access to care. That is critical to people have access to care, and that's with their primary care physician, whoever they view as their primary care physician, primary care provider. And it's also making sure that people, once they get to access that care, have care that's high quality, meaning care that's going to improve their outcomes, evidence-based care, really, really essential. And also, it involves healthy behaviors, exercise, nutrition, sleep, things like that are really important. And then also our physical environment. All of those things impact our physical health. So those are some of the more specific components that we address and support. And then we think about behavioral health. That's really just identifying or appreciating the fact that many of us, everybody's at risk for behavioral health issues, and it's being able to identify when they're present. Also identify when we may be at risk for those, and we can talk a little bit more about that later on. And then also making sure people have access to care and equitable treatment. It's all those things with specifically to behavioral health. And for a long time in healthcare, behavioral health was sort of secondary to physical health, and unfortunately that's changed a lot. And then the third area is social needs. So we view social needs as social drivers of needs. Many people may have heard the term social determinants of health, which is very commonly addressed and used. We prefer the term drivers versus determinants. Meaning determinants implies things are sort of determined for you. They're kind of fixed. You really can't do much about it. And we believe that we understand there are things outside of the healthcare system that drive our health, but those are changeable. It may take a lot of effort in all of us to do it, but those are changeable. And it's more forward-thinking, more action-oriented. And so we prefer and think about it through social drivers of health. And so that's kind of some of the underpinnings of how we approach whole health in a more focused way. And so
that's definitely a lot to unpack. I'm sure we're going to get into a little bit more later, but I hear you talking about health equity. So how is health equity prioritized with the whole health approach within?
Yeah, so health equity is such an important concept. And it's not only a concept, it's really a challenge that really needs to be addressed every day. And we all have a part in addressing health equity. That's really essential. And at Anthem, our philosophy around health equity is really what we term equity by design. And equity by design really means that everything we do, from our business strategy to our business operations to all planning and decision making, is viewed through the lens of addressing health equity. So it's really embedded in everything we do. It's not just a one-off. It's not just one project here addressing health equity. It's everything we do. What that does, that helps us really focus and make health equity a priority in everything we do. And we can make sure we're prioritizing individuals' needs, the people who have the greatest needs, and making sure we're bringing the resources available to them to meet those needs. So that's really a critical way to address health equity. And then you think about it from a business perspective. So if I'm a business leader, we know what makes a business successful, also, but we know that any successful business is predicated on healthy workforce, healthy people. So we know that keeping people healthy is great for them as individuals, and it's the right thing to do, and it really impacts the bottom line for your business. There's no doubt about that. So it's important that health equity for everybody is good for all communities. Healthy people, meaning healthy communities, and a strong community, and a strong Georgia for everybody.
I love that. I love that. Strong Georgia for everybody.
Yes,
Y'all remember that. So now I want to circle back to the physical aspect of health. How does Anthem address the physical drivers?
So there's a lot to unpack in this one area as well. So there's kind of two main avenues I'll touch on. There's a lot, but there are probably two we can touch on that are really important and valid. So one area, just to back up a little bit, in healthcare, historically has been sort of what's called fee-for-service for decades, for longer than that. So fee-for-service means that healthcare has been incentivized by doing more tests or doing more procedures, seeing more patients. I'll never forget when my father was an OBGYN, and he was seeing patients. Every time I'd go to his office, the emergency room was full of patients. But he had a lot of patients to see, they had a lot of needs, but also that was kind of how things were sort of incentivized in some ways. And so, fortunately, healthcare has transformed in this area much more towards value or value-based care. And what does value mean? We define value, you can think of value in kind of three, simple, essential terms. That's improving quality of care as well as patient outcomes, health outcomes. improving the cost of care is the second part of that, right? And improving the experience. So experience for patients and experience for providers. So that's kind of when we think about value. So how does that look, and what does it look like in Anthem, and what does it matter to you and your doctor and the communities at large? So we have over 70% of our providers across Georgia that are in some kind of value-based agreement, which means they focus on those areas primarily, which is the right thing to do. And we meet with those providers, and it's large health systems, it's providers in all parts of Georgia, small practices. Meet with them on a monthly or quarterly basis, a regular basis, talking about those high-level areas, quality, cost, experience. And we also have them, they bring to us any specific issues that any of their patients or have needs around, and use that as a way to problem solve and bring solutions to meet that specific member's needs. Now, we have a great example of something that we experienced in the last year or two with one of our providers in Southeast Georgia. So we're meeting with them during our what we call value-based rounds. And so he mentioned to us that he'd just seen one of his patients who was just discharged from the hospital. He didn't know that she was even admitted to the hospital. However, he found out during that visit that the reason why she was admitted to the hospital was because there was complications with her diagnosis or condition. It was diabetes, and it turned out she had stopped taking her diabetes medication. But the reason was he found out we didn't know why she had stopped taking the diabetes medication. So it turned out there was something with respect to there was a reason, root cause as to why she stopped it. So he brought that to our attention. Asked the question: is there something we can do to help make sure this doesn't happen for this patient, this person again? And also, if it's happened to her, it's probably happened to other people as well. We wanted to not to happen to anybody else. And so we took that back and really talked to internally within our organization and with the collaboration with that provider and the health and the pharmacy systems. And we launched a program that allowed the members us to be triggered or notified if somebody didn't pick up their medication. What that would do is then reach out to the member through text, and they can opt in. And we can ask a few questions to find out, was it cost? Was it side effects? Was it something else that led you to not, to continue on your medication? And if it was something related to understanding of their health condition, they could be enrolled into a 30-day program to help them manage their condition with the case manager. Or they had the option to be connected directly with the case manager right then and there, or connected with a pharmacist right then and there. So it was, and so we put in, as opposed to like addressing it one-on-one, we ended up taking an issue, adjusting it for that patient and that provider, and developing a system or systems that really helped address some of the gaps in healthcare that just exists for the longest time, and trying to avoid that happening to anybody else. So that's an example so why does it matter to everybody? It's a great story for that patient, of course, but it also means it shows how we're connected with providers to meet real needs that they have, that providers have. You can imagine if you can avoid those hospitalizations and all that care and those complications from a cost perspective, that's win-win right there. And more importantly, it's personalized for what that member needs. It's the right thing to do, and everybody's healthier, and overall, it's a better way to deliver healthcare.
Well, the identifying the root cause, because in some way, somehow, all of health is connected together.
Yes.
Yes. Which kind of leads me into my next question. Okay. Being that everything is connected, how does Anthem address the behavioral health as a part of whole health?
So behavioral health is such a transformative area of healthcare. So as I mentioned before, for a long time, people focused primarily on physical health. Behavioral health was kind of secondary. However, even once the COVID-19 pandemic hit, that changed everything. Even before that, we'd seen, especially even in pediatrics, we had seen increases in the rates of adolescents and with depression and anxiety and so forth, and that was happening also in the adult population. And so the demand has been rising, and then COVID-19, just everything exploded. So the demand went through the roof, and we needed to make sure we're meeting the needs of people to get the access to that care in particular. And so we really address behavioral health by making sure people have equitable access to care. And that means that we do that in a lot of ways. That means ensuring, of course, we have networks of providers all across Georgia, but also it's how they access care, making sure not everybody needs an in-person visit. Some people prefer remote virtual visits, and that works for many people. We also have networks that make sure we're sort of being able to have good cultural connections with people. Sometimes the cultural connection between a provider and a patient matters a great deal, or can make the difference in really how their care progresses. And that's really important as well. We're excited because there's a lot of programs around in-home care either. There's a lot of people who get some in-home care for certain behavioral health conditions as well. So it's great. It meets your needs from a time perspective. It's confidential. It's optimal for many people. And we have programs that address substance use disorder, alcohol use disorder, which is actually been on the rise since the COVID-19 pandemic as well. So we really focus on really making sure it's one of our hard priorities for whole health, and so making sure access to behavioral health is one of those, and to the point where actually we will have a future episode dedicated specifically to behavioral health needs. Exactly. So there's so much there to learn about, to hear about, to discuss, and so much opportunity. So excited to talk about more in the future.
Me too, and I know that we will be talking about it more, but I do kind of want to just get into that because I think that's something that people need to know about and understand, because we're talking about how it all connects. So I want to talk about how the physical connects with the behavioral and vice versa, like those different things. The depression can lead to physical illness, or physical illness can lead to depression and mental illness. That's really important, especially for my generation. My generation is going through a lot. So that's something I think the people need to hear, and maybe just a little bit, and then we'll get more into it next time. But I do think that's something we should just hit on. Absolutely.
You must be psychic, because this is really a great topic. So I'm a little older than your generation, but I still can relate, I think. So yes, so you mentioned those pillars as physical health, behavioral health, and social needs. And so it's important to recognize that behavioral health and physical health aren't just isolated, discrete things. There's a strong interplay between those two, meaning that if somebody has a physical condition, it really can often increase the chance of a behavioral health condition. What we know is that people with one chronic condition, such as diabetes or hypertension or asthma, for examples, are 2 times more likely to have issues with depression and or anxiety. And also healthcare costs are 2 or 3 times as much as well. So that's how that translates as well. I can share a personal story about how the interplay between behavioral health and physical health is very real and relevant to me. So in 2023, I lost my mother, and so thank you. She was a great inspiration to me and all of us, and of course I was grieving her loss. And over the course of the next 3 or 4 months, it became evident that I wasn't grieving in a healthy or productive way, and so it was impacting my health in negative ways. And so finally, ultimately through, fortunately, my own doctor, my own PCP, and being very candid with me, and know I needed to address the physical issues, but he made sure I really tried to get into what was the root cause of that. And it turned out I was depressed, and I didn't recognize it, and that's how it was manifesting. That was a watershed moment for me, because I realized I had to address both things. Obviously, I needed to make changes for my health, but also I needed to make sure I was addressing my behavioral health and realizing that's what was driving that. So being able to recognize both of those, and then address both of those was so critical for my health overall. And that's almost a year ago, and I was much happier. Much happier where I am behavioral health-wise, much healthier. 25 pounds later, I saw my doctor last week, and I sleep better. I'm just happier overall. I just feel better, and so I think it's really important. It's important to share my story, but also it's relatable. Everybody has loss, and I think in different ways, and you handle it different ways, or you cope with it different ways, and it's recognizing if we need help and being able to get the help that we need in a way that's going to make a positive difference.
Wow.
Yeah.
I just want to take time to address, I don't know if y'all are paying attention or not, but everything is important to identify the root cause. I just want y'all to remember that. But yes, my next question is, what strategies does Anthem use to address maternal health and maternal health disparities?
Oh, so this is another huge topic and area. It's a lot. It's great, and it's important. It's really important to the point where we're going to, again, that will be a future episode dedicated to in and of itself. So as a pediatrician, I was taking care of infants, even in the hospital in their first day of life, for 20 plus years. And so I saw firsthand the impact of maternal complications and maternal health on, of course, the mother, as well as on the newborn, on the infant. And over time also was able to see, unfortunately, how more prevalent those complications are in not only our country but also in Georgia, and how prevalent and how wide the disparities are. Meaning, a lot more African American women, particularly in Georgia, have issues with complications with pregnancy, both during pregnancy and after pregnancy. African American women have a lot more even deaths related to pregnancy. So that's just two examples of disparities that have always been there, and it have just been exacerbated or more relevant or more aware since the pandemic as well. So maternal health is such a critical area to address. And again, there's a lot of issues there, but the solutions are out there as well. They're multifaceted. It takes a village, as they say, and so it really takes clinicians, healthcare providers, health systems, all of that to really address and even in government organizations to address some of the barriers around maternal health. But we're going to get to that in future sessions as well with myself and maybe some of my OB colleagues. So we're excited to get into that. And again, it's about solutions, not just the problems, but solutions.
I'm excited. I'm really excited. I'm excited for all the upcoming episodes, honestly. That's going to be a great episode because I know that's a lot to unpack. Maybe 2 or 3 episodes for that, just one. But this was nice. This was great. I hope we all learned something here today. Hopefully we paid attention. Thank you so much for having me, and thank you for just taking the time out your day to talk with us all.
The pleasure's mine. Thank you so very much. Thank you.
And this has been the first episode of Paging Dr. Jones, Transforming Wellness Together.
Thank you.
Thank you.